Hello everyone, and welcome back to our channel. Today, we will be discussing a topic that has become increasingly relevant in this day and age, and that is the complications of uncontrolled diabetes and its long-term risks. Diabetes is a chronic disease that affects the body's ability to produce or use insulin, which is the hormone responsible for regulating blood glucose levels. When blood glucose levels are high, it can lead to a range of health problems, particularly if the disease is left uncontrolled. The first long-term risk of uncontrolled diabetes is damage to the kidneys. High blood glucose levels can cause damage to the small blood vessels in the kidneys, which can impair their ability to filter waste products from the blood. Eventually, this can lead to chronic kidney disease or even kidney failure. The second long-term risk is damage to the eyes. High blood glucose levels can damage the small blood vessels in the retina, which can lead to diabetic retinopathy. This condition can cause vision loss or even blindness if left untreated. The third long-term risk is damage to the nerves. High blood glucose levels can cause damage to the nerves throughout the body, particularly those that control sensation in the hands and feet. This can cause a condition called diabetic neuropathy, which can lead to pain, numbness, and even amputation of the affected limbs. The fourth long-term risk is damage to the cardiovascular system. High blood glucose levels can cause damage to the blood vessels, which can increase the risk of heart disease, stroke, and other cardiovascular problems. The fifth long-term risk is damage to the feet. High blood glucose levels can cause damage to the small blood vessels and nerves in the feet, which can lead to foot ulcers, infections, and even gangrene. If left untreated, this can lead to amputation of the affected foot or leg. The sixth long-term risk is damage to the skin. High blood glucose levels can cause damage to the blood vessels and nerves in the skin, which can lead to skin infections, slow healing of wounds, and even skin ulcers. The seventh long-term risk is damage to the teeth and gums. High blood glucose levels can increase the risk of gum disease, which can lead to tooth loss and other dental problems. The eighth long-term risk is damage to the digestive system. High blood glucose levels can cause damage to the nerves that control digestion, which can lead to a range of problems, including gastroparesis, a condition in which the stomach takes too long to empty its contents. The ninth long-term risk is an increased risk of infections. High blood glucose levels can weaken the immune system, making it more difficult for the body to fight infections. The 10th and final long-term risk of uncontrolled diabetes is an increased risk of developing other health problems. People with uncontrolled diabetes are more likely to develop a range of other health problems, including depression, sleep apnea, and cognitive impairment. In conclusion, uncontrolled diabetes can have a range of long-term risks and complications, including damage to the kidneys, eyes, nerves, cardiovascular system, feet, skin, teeth and gums, digestive system, an increased risk of infections, and an increased risk of developing other health problems. If you or a loved one has been diagnosed with diabetes, it is important to work closely with your healthcare team to manage the disease and prevent these complications. Thank you for tuning in, and we will see you next time.